Too many people are continuing to work and they're on their insurance at work, their employer's health plan. And they sign up for Medicare and they're paying for Medicare. And I'll ask them, why are you doing that? And they're like, well, better safe than sorry, because I didn't want to get a penalty. There is no penalty if you have an employer group health plan that has over 20 employees. So you do not have to sign up. You do not have to pay for Medicare Part B. If I'm on my spouse's plan or it's my own plan and it's 20 or more employees, that's the rule. So now stop right there because you're like, okay, cool. And I'm not going to get Medicare. Medicare might be better. It might be better insurance. It might be a lower deductible. It might be better benefits, better copays than what you have at work. So I'm just explaining to you the rule. Don't make the assumption right away and click out of my video and go like, okay, fine, I'm not getting Medicare. Medicare might be better. But don't have both. There's very rare occasions where you would have both. So how does it coordinate? That's the insurance lingo, right? So if I have my employer insurance and I signed up for Medicare A and B because I didn't know, I didn't call the Medicare family, I just guessed it. My employer insurance would pay first. It'd be primary, and then Medicare would pay secondary, which means it would hardly ever pay, which means you're paying for Medicare Part B every month, in most cases, needlessly. And Medicare Part B is at least $165 in 2023. It's supposed to go up $10, $15 for 2024. Do you need to pay that if you're not going to use it? No, I wouldn't. I would do a benefit comparison, whichever one is better, and stay there. Now, typically when you continue to work at 65, you will enroll in Medicare Part A. That's already paid up. It's premium free. They took it out of your paycheck the whole time you were working. So at 65, you don't pay for A. Most people, there are people that have to, but most people do not. So most people will sign up for A. If they did have a lot of extended hospitalizations, A could be secondary, could come and help. But don't sign up for A if you have a health savings account. Watch my other videos because you can't have a health savings account and be on Medicare Part A. You'll get a 10% tax penalty and you will not get the tax savings that you think you're getting. So that's another whole video for you to check out, or go to my website. I have a lot of information on health savings accounts at themedicarefamily.com. Remember this number, 20, that's the magic number. So people say, well, I was told I didn't need Medicare Part B because I'm still working. Okay, that's the first part. Then I'll say, how many employees? And they'll say 8, 5, 3. I say, well, it's still working for an employer with the magic number of at least 20. So if you have under 20 employees, here Part B and Part D late penalty if you later sign up for Medicare. So if you ignore this rule and you're like, I don't need it, eventually when you do sign up for Medicare, you will get hit with that stiff penalty. If your employer has over 20 employees, you're not going to get hit with that penalty. You are exempt. Now your employer gives you a letter every year that explains the fact that you have creditable coverage. Save the letter. Because I've had employers go bankrupt and then they disappear and then we have to it's hard to try to prove that you were employed there for the last 5 years. So save that letter. They have to send it to you by law. If you don't have it because you've been watching this and you've been on employer health insurance for a couple, don't panic. I'm just saying, if you're just now retiring, just save the letter. Safe than sorry. If you have more than 20 employees, then your employer health insurance is primary. Medicare only pays secondary, and it might not ever pay. So if that was clear as mud, be sure and subscribe. And if it wasn't clear, ask me in the comments. I have a lot of common question and answers and retirement guides on our website, themedicarefamily.com. So go check that out or ask us in the comments below. We'll be happy to answer your questions. If you like this video, you might really like this video. Check it out. And we'd appreciate if you subscribe to our channel so you never miss a great video. We put out one every week. Check in the description below this video for a link to our cheat sheet on Social Security and Medicare. And you can also give us a comment. If you have a specific question, always feel free to call us or email us at the Medicare Family.